Hi everyone, my name is Mehar Sighat and I am one of the 2024 summer research students at OSER. Working with Dr. Shubha Balur, we've conducted research assessing the prevalence of various prognostic pathological variables of IgA nephropathy in the South Asian community at William Osler Health System. Now to begin, IgA nephropathy is a very common autoimmune disease that can cause chronic renal failure. Primary IgA nephropathy is characterized by the deposition of galactose-deficient IgA in the kidney, which can cause morphological changes, and it's known to be particularly severe in Asian populations in terms of its symptoms and its progression. The Oxford classification is an important part of understanding IgA nephropathy. It's a prognostic tool that was developed in order to group patients into risk categories based on their pathological and clinical variables. A patient is assigned a MES-C score based on an assessment of a number of factors in their renal biopsies, which can help predict the severity of the disease's progression in a number of different ways. Now, since its publication in 2009, the Oxford classification has been validated in many cohorts, including large European, Chinese, Japanese, and some South Asian cohorts. Now, seeing as the William Osler Health System serves a diverse community, including a large South Asian population, it presented us with the opportunity to assess patient outcomes of IgA nephropathy in South Asians, a group that is at risk for more severe symptoms and progression of IgA nephropathy. Our objective was to assess the prevalence of various pathological parameters based on the Oxford classification and to study the clinical outcome of IgA nephropathy in the South Asian community. We're also comparing these findings with other cohorts of various ethnicities. We began by conducting a retrospective chart review of 120 South Asian patients that were hospitalized at Brampton Civic Hospital between January of 2011 to April of 2024. We looked at the patients' MES-C scores as well as the prevalence and severity of arterial sclerosis and arteriolar hyalinosis from their renal biopsies. Now, to compare the frequency of MES-C lesions in our cohorts with the frequencies of other international cohorts, we used a test of proportions to obtain our p-values. We found that in the William Osler Health System cohort, 49.2% of patients had M1 lesions, 52.5% had E1 lesions, 87.5% had S1, 42.5% had T1 or T2, and 28.2% had C1 or C2 lesions. Now, these values showed a statistically significant difference from the MES-C lesions of many of the international cohorts of comparison upon performing our tests of comparison. For example, the M1, E1, S1, and T lesions in the Osler cohort were higher in frequency than most of the other international cohorts. The C1 and C2 lesions were highly comparable with the studies we assessed, with the Osler South Asians having a higher frequency than the European, Indian, and South Indian groups, but a lower frequency than the Chinese and Oxford cohorts. Our cohort also showed a comparable value of frequency in terms of the E1 lesion to the Oxford study, the S1 lesion to the Chinese cohort, and the T lesion to the Indian cohort. The only other time that the Osler cohort showed a lower frequency of lesions was M1, which was lower than the Indian cohort that we compared to. We also assessed the distributions of our cohort for severity of arteriolar hyalinosis and arterial sclerosis, which are other factors that can indicate the severity and progression of IgA nephropathy. Our assessment showed that approximately half of the South Asian cohort had no prevalence of these factors, with the other half ranging from about mild to severe. In conclusion, the South Asian cohort at William Osler Health System showed a pathological distribution that mostly varies from other international cohorts of various ethnicities, and it's comparable in some aspects to cohorts that are susceptible to more severe IgA nephropathy, including the Indian and Chinese cohorts of comparison. Also, evidence from many studies shows that S lesions are associated with poor clinical outcome, and they're noted in 86% of biopsies in our study. However, any conclusion that we make requires correlation with clinical data, which will be undertaken in future studies. Our goal in terms of future work is to collect clinical variables, including follow-up data and clinical outcome of these patients in accordance with the Oxford classification, and to correlate the pathological findings from this study with the clinical variables from the future. We'd like to thank William Osler Summer Student Research Program and the Osler Research Institute for Health Innovation for supporting us through this research. Thank you so much.